If your legs feel heavy, tire quickly, or begin aching after a short walk, the problem may not begin in your muscles. It may begin inside your blood vessels. Researchers tested one ordinary seed in people with peripheral artery disease, a condition that restricts blood flow to the legs. After eating it daily, participants experienced meaningful changes in two major cardiovascular risk factors. However, one result revealed an important limitation that most health videos will never mention. So, what is this seed, and what can it realistically do for your legs? Your legs depend on three systems working together. Your arteries must deliver oxygen-rich blood. Your nerves must communicate with your muscles. And your muscles must remain strong enough to support your body. When circulation becomes impaired, walking may cause cramping, aching, weakness, or unusual fatigue, particularly in the calves. People often dismiss these symptoms as normal aging. But persistent leg discomfort can sometimes indicate peripheral artery disease, nerve damage, arthritis, medication effects, or another medical condition. The seed researchers examined contains soluble fiber, plant compounds called lignans, and an omega-3 fatty acid known as ALA. That seed is ground flaxseed. Now let's examine what may happen when you eat it every day, what it cannot do, and the safest way to use it. Number 1. It may support healthier blood pressure. High blood pressure gradually damages the inner lining of your arteries. Over time, the vessels can become stiffer and less able to regulate blood flow efficiently. This affects the entire body, including the arteries supplying your legs. One important randomized controlled trial studied 110 people with peripheral artery disease. Participants consumed foods containing either 30 grams of milled flaxseed or a placebo every day for 6 months. Compared with the placebo group, systolic blood pressure was approximately 10 points lower, while diastolic pressure was about 7 points lower in the flaxseed group. The effect was even greater among participants who started with high blood pressure. This does not mean everyone who eats flaxseed will experience the same reduction. These participants had an existing vascular condition, and the researchers used a specific daily amount under controlled conditions. But the result matters because blood pressure is one of the major risk factors affecting arterial health. The ALA in flaxseed may influence compounds called oxalipins, which participate in the regulation of vascular tone. In simpler terms, flaxseed may help create an internal environment in which blood vessels regulate pressure more effectively. That could support circulation throughout the body. But lower blood pressure does not automatically mean that blocked leg arteries have reopened. That distinction becomes important later. Number 2. It may help reduce harmful LDL cholesterol. LDL is commonly called bad cholesterol because excessive amounts can contribute to plaque formation inside the arteries. As plaque accumulates, the passage available for blood becomes narrower. In the coronary arteries, this can affect the heart. In the peripheral arteries, it may restrict blood reaching the hips, thighs, calves, and feet. In another analysis from the same clinical trial, participants eating 30 grams of milled flaxseed experienced a 15% reduction in LDL cholesterol after 1 month. The effect was not equally strong at every later measurement. However, participants using cholesterol-lowering medication still experienced an additional LDL benefit after 12 months compared with the placebo group. Flaxseed contains soluble fiber, which forms a gel-like substance inside the digestive tract. This can reduce the reabsorption of bile acids, encouraging the body to use circulating cholesterol to make more bile. But flaxseed should not replace prescribed cholesterol medication. Think of it as a supportive food that may complement an appropriate diet and treatment plan. Improving LDL cholesterol may help slow the processes that threaten circulation, but it cannot remove an established arterial blockage overnight. Number 3. Your legs may not become stronger automatically. This is where we need to separate biological plausibility from proven results. If flaxseed improves cardiovascular risk markers, it is tempting to assume that people will immediately walk farther, experience less calf pain, and develop stronger legs. The clinical evidence did not show that. In the peripheral artery disease trial, both the flaxseed and placebo groups improved their walking distances. However, the difference between the groups was not statistically significant. In other words, researchers could not confidently say that flaxseed itself improved walking ability. Why is that important? Because leg strength requires the muscles to be challenged. Food may provide supportive nutrients. Better risk factor control may protect your arteries. But neither replaces walking, resistance exercise, physical therapy, or medical treatment when these are appropriate. For someone with peripheral artery disease, a supervised exercise program can be a central part of treatment. For someone losing muscle with age, progressive resistance exercise, and sufficient protein are much more directly connected to rebuilding strength. Flaxseed may support the environment in which your legs function. It is not a substitute for using those legs. Number 4. It may improve digestive regularity, but only with enough fluid. Ground flaxseed absorbs water and adds bulk to stool. For someone dealing with constipation, this may improve bowel regularity. That may seem unrelated to the legs, but persistent constipation can reduce comfort, activity, and willingness to exercise. There is also a warning. Adding a large amount of flaxseed too quickly can cause bloating, abdominal fullness, gas, or diarrhea. And eating fiber without adequate fluid may make digestive discomfort worse. Start with a small amount, such as 1 teaspoon of ground flaxseed daily. Give your digestive system several days to adjust. You can then gradually increase the amount if you tolerate it well. A practical everyday serving is often 1 to 2 tablespoons. However, remember that the major peripheral artery disease trial used 30 grams daily, which is a larger amount than many beginners will tolerate comfortably. More is not automatically better. Number 5. It may support metabolic health, but the evidence is mixed. Elevated blood sugar can damage blood vessels and nerves over time. When nerves in the feet and legs are affected, a person may experience burning, tingling, numbness, or reduced awareness of injuries. Flaxseed's fiber may slow digestion and help reduce rapid rises in blood sugar after a meal. However, evidence for flaxseed supplements as a treatment for diabetes remains inconsistent. It would be irresponsible to tell someone that flaxseed will reverse diabetic neuropathy or heal a diabetic foot problem. It will not. If you have diabetes and begin changing your fiber intake, monitor your blood sugar as directed. Speak with your healthcare professional, especially if you use glucose-lowering medication. And never wait for a food remedy if you notice a foot wound, skin color change, sudden numbness, or signs of infection. Number 6. Ground flaxseed is more useful than swallowing it whole. Whole flax seeds can pass through the digestive system without being completely broken down. Grinding the seed makes its internal components more accessible. You can purchase ground flaxseed or grind whole seeds at home. Keep ground flaxseed in a sealed container, preferably in the refrigerator or freezer, to protect its oils from heat, light, and air. Mix it into oatmeal, plain yogurt, soup, or a smoothie. Do not depend on flaxseed oil for the same effects. The oil provides ALA, but it does not contain the intact seed's fiber. Therefore, flaxseed oil and ground flaxseed should not be treated as nutritionally identical. Avoid eating raw or unripe flax seeds because they may contain potentially harmful compounds. Flaxseed is not the correct response to every leg symptom. Seek urgent medical attention if one leg suddenly becomes swollen, warm, red, or painful, especially if this is accompanied by chest pain or shortness of breath. Contact a healthcare professional if you repeatedly develop calf pain while walking that disappears with rest. That pattern may indicate peripheral artery disease. Also report feet that remain unusually cold, wounds that heal slowly, changes in skin color, or new numbness. These symptoms require an evaluation, not another spoonful of seeds. Flaxseed may also interact with certain medicines, including anticoagulant or antiplatelet drugs. If you take blood thinners, blood pressure medicine, diabetes medication, or several prescription drugs, discuss daily flaxseed use with your healthcare professional. So, what happens to your legs when you eat ground flaxseed every day? It may help improve certain risk factors that influence circulation, particularly blood pressure and LDL cholesterol. Its fiber may support digestion, while its ALA and lignans may contribute to cardiovascular health. But flaxseed has not been proven to directly strengthen weak legs, reopen blocked arteries, cure neuropathy, or eliminate walking pain. The strongest strategy is not a miracle seed. It is ground flaxseed used as one part of a larger plan that includes appropriate exercise, adequate protein, blood pressure control, cholesterol management, and medical attention for persistent symptoms. Now I want to hear from you. Which problem affects your legs most? Weakness, nighttime cramps, swelling, numbness, or pain while walking? Write just one word in the comments. And subscribe because in the next video, we'll examine the everyday habit that can quietly make leg circulation worse, even when you believe you are resting your legs.